purpose of Comfy Connection is to share knowledge and resources, but also to highlight individuals that have made their dedication to their professional career, turn them into today's celebrity, as I like to say. So that's why I created this format to do that. And we have individual sponsors to offer them the exclusivity and exposure to individuals like yourself, healthcare professionals. So that's why I created the platform. A lot of people say, well, Norman, what do you do? So my full-time job that pays my bills, I work for Evolutionary Healthcare. We're a multi-specialty physician group. We specialize in osteopathic manipulative treatment, which is a non-pharmacological intervention that could be utilized for comorbidities and illnesses in the long-term care space. My dream and my goal and vision is Comfort Measures Consulting, a platform that embraces and elevates the voices of healthcare professionals, but also share knowledge and resources to communities.
Everybody, so pleased to have you here at Metro West. Of course, I'll have to do a little description for those of you who have not been to our facility before, but I know some of you are already current collaborators and partners and supporters, and we appreciate that because we cannot do that without you. We are a 120-bed skilled nursing facility, Rehab. You are currently in our Rehab gym, so we hope you've had an opportunity to look at some of the technology that we have through Accelerated Care Plus programs, and we're very proud to be able to partner with them to have advanced technology to rehab our patients here in this community. I've been a nursing home administrator for 26 years now, been at this facility for 1 year, and I tell you it's been pure joy working with this team. And thank you, Norman, for giving us this opportunity to host the event today. We're looking forward to our guest speaker, Ms. Joy, and of course the others that will be speaking today. And thank you for sponsoring. We appreciate your support and sharing, what you have to offer to our community. And again, thank you and welcome. We love having you here.
Thank you so much for having me. I truly appreciate the opportunity to be here supporting the people who need it the most, right? And so if you know anything about me, I came from post-acute. I know the journey, and I do everything in my power now to support people that are newly in their roles, some who have been in their roles for quite some time. But as we know, the longer you're in that role, sometimes we get a little bit tired, right? We get, it's not as if we're doing the job that everybody wants to do, right? It's a calling. It's truly a calling. And so as you follow and walk into that calling, the whole purpose is for you to understand that every once in a while, you need somebody that you can just rest your shoulder on, somebody who you can reach out to. My name is Joy McMillon, and I'm a good person to reach out to. I will take their call. I will be there for you, and I'm a supporter in all ways, because what I want to see happen is for us not to see all of the ebbs and flows and ups and downs. We already know that's going to happen with the regulatory and everything like that. There's enough stress on post-acute. There's enough. We're here to take some of that burden off, help to breathe through it, and help to talk through it, because sometimes all people need is someone who's going to support them.
The wonderful Jennifer Scahill is our first interviewee up today, account manager from KG Health Partners, mobile podiatry servicing long-term care services. Give her a round of applause. What's your bedside model? What's KG Partners' bedside models, and what you guys provide to long-term care that separates you from your competitors?
Certainly. So the skilled nursing, assisted living, and independent living facilities that we provide services to, some of the residents just have a really difficult time, with getting out and about. Transportation is sometimes an issue. So us going to the facilities, going room to room to see the residents, it really allows for a more seamless experience, not only for the resident, but for the facility staff as well. So we're able to help with the scheduling of all of the podiatry services. We let the staff know who's expected to be seen during that visit. And then we show up to the patient's rooms and provide the services.
Share with them in 10 seconds, 20 seconds, why should they choose a career in healthcare?
It's so fulfilling. It's so fulfilling to know that your hard work is really paying off. Someone is reaping the benefits of the hard work that you're putting out there, and it's a really good feeling.
Jennifer Scahill, KG Health Partners. Thank you. All right. This next guest, back to back with me, Miss Tammy Rogers. Welcome her to the stage. Marketing liaison. Been in the healthcare space, both in home care. Now she's with Mortellaro. Did I say it right? Mortellaro. I can't say it right. Mortellaro Law.
I always try to promote everybody getting their advanced directives. People underestimate advanced directives. Our advanced directives actually include not only your power of attorney, you got your healthcare surrogate, pre-need guardian, which is huge. Not a lot of people have that in their advanced directives. Ours are 32 to 35 pages long, which also include your living will and your predisposition of remains. But I think for especially the skilled nursing side of things, our advanced directives include verbiage that helps protect people from the Medicaid 5-year look-back period. So we are able to actually help people get on Medicaid that have assets. The statistic is 80% of Americans do not have a will or trust. That is scary.
Wow. What's the percentage again? 80?
80.
80%. Wow. We bring awareness here at Comfort Measures Consultant, Mortellaro Law as well. Miss Tammy Rogers, a stronghold in the industry as well, a staple in the industry. You do wonderful things and have a wonderful commitment from the home health, hospice, and now legal aspect, all in healthcare. So we appreciate you having us today. If you had one last message to share with our audience, what would it be?
Get your advanced directives.
All right.
Please call me. Yes, I would love to have everybody have their advanced directives, just because it's not just for you, it is for your family, because there's nothing worse than having to second guess what your loved one wants in a crisis mode. So get your advanced directives.
Y'all hear my applause thing? I got my applause, man, for real. All right. So our next guest here with SimplyThick. She is a National Sales Award winner. Miss Michelle Baker. I had to say that. You know I did. Thank you so much for joining us today from SimplyThick. All right.
Hello.
All right, Miss Michelle
The challenge
Baker.
that I'm seeing in my current main mission right now with SimplyThick is I do a lot of education around an initiative called IDDSI. For so long in food service, especially in post-acute, it hasn't been, dysphagia menus, thickening liquids hasn't always been a huge topic of conversation because it gets so wrapped up in the PPD for the patient. It's really challenging it's never been really important, but I've worked so much with acute care with implementing and switching over to this new terminology. And there was no real guidelines of how to make a puree or a ground diet or now it's called a mixed and moist diet. But now because they have realized, the reason is there's a global initiative is they've realized because there were no standards, people were choking, they were aspirating, they were dying. So
Are you guys targeting different segments of healthcare, whether it's inpatient rehab for hospitals or
Sure.
Skilled nursing facilities, ALFs?
Yeah, we have really spent a lot of time in acute care over the past couple of years, but this year we've really focusing on post-acute assisted living because we have such a huge gap in the continuum of care with the IDDSI and that standard of care. So right now, focusing on most of the ALF post-acute chains like Southern Healthcare and quite a few others, but pretty much anybody on post-acute or ALF, we're focusing on pretty hard this year because we've got to close that gap.
All right. So thank you all for attending. Somebody told me focus on the people who are there for you. So I got to do a better job. All right. Yeah. I appreciate it.